Hi there, it's Dr. Malka, your chiropractor and acupuncturist practicing in Los Angeles, California. And today I'm here with Greg and I'm treating what's called a frozen shoulder syndrome. What that is there's a muscle underneath this wing bone called your scapula, and that muscle gets really tight. And what happens, how we can diagnose this, is in a normal shoulder pain or injury, the person may not be able to lift the shoulder up on their own, but then I'm able to lift the shoulder up. But if the patient can't lift the shoulder up and I also cannot lift the shoulder up, it's called a frozen shoulder or adhesive capsulitis. And oftentimes patients will present with mainly pain in the front of the shoulder as well. And so the way I treat that, in this particular condition, acupuncture is by far, if you could do one thing, that's the best way to treat it. But I like to start off in the side lying position, and I bring his arm up in this position like this, and then I go ahead and come underneath the arm. I'm using a cloth because I have longer nails. I come up underneath and I literally stick my finger right up underneath. I'm not in the armpit, I'm up underneath in that muscle, right underneath the subscapularis. I'm going to pull the shoulder forward and really get my thumb right up underneath this area. The problem with this particular treatment is that I can only affect maybe 20% of the muscle. And that's why the acupuncture is so effective, because the needles can go right up underneath and release it. And then another way of treating this, it's so painful, but really the only way that a person can then self-treat this is to do wall crawls or really try to force that arm into range of motion. Usually they can kind of bring it up to here, maybe bring it up to here. And so what they really need to do is face the wall, do wall crawls, and they really need to force that arm into range of motion, and then do it in the side position too, to the point where tears come down. This condition can be so sensitive also that people have been known to go under anesthesia. It's called MUA, manipulation under anesthesia, where they put the person to sleep and then force the arm into the range of motion because it's so sensitive. But I really feel most of that could be avoided with therapy and mainly acupuncture. Continuing on with acupuncture, I find the patient usually has to have something supporting the shoulder up, because having the shoulder drop down will really cause pain. So I've got him elevated a little bit here, elevated here, because once we put the needles in, he's going to be lying here for 10 minutes. So I just want to make sure he's really comfortable. And again, it's this muscle underneath the scapula. So I'm going to be angling the needle right underneath the scapula to affect that muscle. And usually if you get the angle really good, it just slides in there like butter. The lifting of the shoulder really helps as well, because it allows it exposes the scapula, so I can really get that needle in there. Okay. There, that one I got at a better angle. This one I had a little up, and so it kind of got stuck on the bone there. You're doing good. Okay, this will be the last one. All right. All right, Greg, you're just going to relax here for 10 minutes. I'm going to turn off the lights and just let you drift off. So now it's time to take the needles out. You know, putting them in can be a little sensitive, so can taking them out. So I'll usually pinch the skin a little bit and then pull them out like this. Pinch the skin and pull them out. And these needles I'm using are 5-inch needles. I usually mention that to the patient after we're finished, not before we begin, because that can freak people out a little bit. All right, Greg, we're all finished. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.